Hi, Mike Gibson and Michael Valentine coming to you live from SCAI 2016. Mike, the American College of Cardiology and SCAI have collaborated very successfully over many years now. Talk to us about the overlap of the two societies, how they complement each other, and how you see them advancing together in the years ahead.
Great question, Mike. We at the ACC have a long-standing history of working together. As you and I were talking a minute ago, the interventional section of the American College has over 7,000 members.
I was not aware it was that big. Now, those are international members as well, right?
Yes, yes. But again, if you look at the interventional section is one of our largest sections and one of our most passionate, as you can imagine.
By vocal sections.
Yes, vocal
Yes.
section, and it's the interventionists. Given all of the news and the appropriate use and all of the issues over the last several years, some of our interventionalists, not only in the United States but internationally, have felt a little under attack and under siege. And so we at the American College understand that. We have been working closely with leadership in hopes of helping to work together long term and create systems of synergy and hopefully create win-wins over time. Because the SCAI members are also our members, we're all together, and we realize a lot of this. We realize the issues that face our members in regards to this.
Yes, and governance issues. I mean, there's some restructuring of governance going on at ACC. How does that impact the interventional guys?
Yeah, a lot of our interventional leaders have been concerned because traditionally many of the top leaders in SCAI have also been top leaders in the college, and we don't see that. Obviously there are areas of fiduciary responsibility. If you're the president of SCAI, you can't be an officer of the ACC because you have to have your responsibility to SCAI. But if you looked at the Interventional Council that I sat on at the recent ACC meeting, almost everyone in that room was a very active SCAI member and many SCAI officers. So, and I think Steve Ramey characterized it very well there. He said, there's no reason that a SCAI officer can't be on the Interventional Council, but certainly can't chair the Interventional Council because of that. But we see relationships of synergy, we see collaboration, we see work together not only in guidelines, consensus papers, advocacy. We obviously the college has to be careful. We can't advocate purely for interventionals, for interventional procedures, because then our non-invasive partners get upset and all. But that's an excellent role for SCAI. I mean, SCAI has the clear path there to advocate for interventionalists in areas sometimes that the college cannot.
Yes. Yeah, I think that's always been a strength of SCAI is the advocacy component. But anything we can do to get help from the ACC, I think that's always helpful as well.
Yeah, well, I think that in areas of cardiovascular care, in systems of care, in registries, all those areas, the college and SCAI work together, and we obviously have the clear path with legislators on when we're doing quality of care issues. So I think those are areas where we work together, quality of care, patient care, systems of improving care, and yet that allows us to leave more of the advocacy for the interventional procedures, things like that, to SCAI where it belongs.
You're currently vice president. You'll then become president in what year of ACC?
2 years. I will be president in 2018. At the same time, Kurt Garrett will be president here. So you have Kenny Rosenfield now, who is working with Rick Chazal, and then next year Minnow Walsh will be the president of the American College, and Peter Duffy will be coming in. So we leadership knows each other well. We work together. Peter Duffy and I have worked on the Cardiovascular Summit for many years together. He was on our committee for the summit, and as Peter and I do lots of work and talk together, and Kenny Rosenfield was the governor of Massachusetts,
of course,
and one of our most active governors, and created tremendous improvements in the Massachusetts chapter. So there are so many areas of synergy, so many areas where we're all members together and we're all cardiologists first. And so I think that we are sensitive to the needs of SCAI, we're sensitive to the needs of our interventional members throughout the college, and we need to just continue great dialogue working together in areas where we can collaborate and create systems that do win.
Well, these leadership positions are voluntary, and you guys do an enormous amount of work. I want to say from everyone at ACC, thank you for all your time and effort. No good deed goes unpunished.
That's right.
You know,
be careful what you wish for, and beware of dubious honors.
Exactly.
Is that right? So, well, we're grateful. I think that you, who have been active in the college as well, all of us realize that whether you're active in SCAI or you're active in the college, it's because you have a passion for improving things that are already well established and good. But you love the ability to work with other people who share the same passions as do you. And so it's a fascinating crew, and I'm honored to be in the position to do so.
Well, we're fortunate to have you as our leader coming up. Thanks for joining us today, Michael, and thanks to all of you for joining us here live from SCAI 2016.